When we make a diagnosis of dementia, what are the steps that we recommend first? So after we make a diagnosis, we talk about the 4 pillars of dementia care. And we've recently added a 5th one. So what are these pillars? Let's go through them. So the first S is the one that we recently added, and that's social and recreational activity. We've talked before about day programs on the Wrinkle, and we know that day programs for people who are living with dementia, or just for older adults in general, can be really important in maintaining brain health. And we know that people with stronger social networks do better when they have changes in the brain associated with aging. So the social piece is a really important part of the treatment for dementia. The T is for treatment and tests. So sometimes we have to do other tests to really confirm that the symptoms we're seeing are related to dementia and not something else. So that test might be some blood work, or it might be a CT scan or some other kind of radiology test. But the tests are something that we might do. The treatment is usually something like a cholinesterase inhibitor. So those are things like donepezil, rivastigmine, or Remenil, which is galantamine. Or it could be memantine. So those medications are usually a fairly modest benefit in treating Alzheimer's and some other types of dementia, and they're not appropriate for all types of dementia. There are also some contraindications to taking the medication. So if you have a very low heart rate, or if it's difficult for you to be able to take pills on a very regular basis, in that case, those meds might not be right for you. But at diagnosis, that's usually where we'll talk about medication treatments. The E stands for education, and that's where we again refer to Alzheimer's Society. People and their care partners who have a better understanding of dementia and what it means in terms of changes in the brain and behavior and lifestyle, they tend to do better when living with dementia, and they can also make connections with peers who are going through similar types of situations. So education is very important. P is for prevention, and prevention sort of has 2 faces. The one is that we want to prevent things that we know can make dementia worse. So for example, if somebody has a stroke and they're already living with Alzheimer's, we know that it'll make the Alzheimer's symptoms a lot more prominent. So preventing stroke and other health complications can be an important part of maintaining brain health. The other thing we want to prevent are some of the complications that we know are more common in people living with dementia. So an example is delirium. Someone with a dementia sort of has a vulnerable brain. So if they're coming in for surgery, or if they're ill with some other illness or starting a medication that could have brain side effects, they are at higher risk of getting delirium. There are things that families and hospitals and doctors can do to try to prevent delirium. So it's really important to review those when it comes up. And the last S is safety. So when the brain is changing related to dementia, there can be safety issues. So somebody could have difficulty, for example, managing medications or driving. Driving is something that we talk about a lot. So safety issues are something that we review at every visit for dementia, but it's usually something we talk about at diagnosis, at least to touch on it, so that people have a sense of what to look for going forward. So when a dementia diagnosis is made, that's usually a difficult day, but we can talk about steps that people can take in order to have a plan to go forward. We call it your brain health action plan, and I find that it's really helpful to tell people the things that they can do to manage with dementia, and then the things that I'm going to do as a doctor and specialist.